Welcome to the school of sexuality. Let's talk about our values, gender equality. Everyone has a body, but no two are the same. Respect, consent, my body is my body. Respect, consent, your body is your body. This is the school of sexuality.
Excuse me. Will you please cover your mouth?
Okay.
Germs. They are everywhere. We have become hyper aware of them since the global pandemic. Over the past couple of years, we have learned just how important it is to protect ourselves from them. We do things like wear masks or wash our hands regularly. There's always a risk of getting sick when we're around other people. Most of the time, we're okay if we do get sick. Sometimes we go to the doctors and we get a medicine and we end up being just fine. It's exactly the same when we have sex with another person. But don't worry. We have ways of protecting ourselves and others from sexually transmitted infections, or STIs. STIs are germs we get when we exchange body fluids or have skin-to-skin contact with reproductive organs. Meet my friend here. Hi. And my other friend. Hi. They're going to help me talk to you about STIs today. There are 3 types of STIs: bacterial, viral, and parasitic. Here, let's talk about them a little bit deeper. STIs are infections that can be spread from person to person through sexual activity. This can be vaginal, oral, or anal sex. They can be spread through both body fluids and skin-to-skin contact. They're really common, and most people do not experience any symptoms when they have them, which is why they are spread so easily. Although most people do not experience any immediate symptoms, if they go untreated, they can cause some serious harm. The good news is getting tested for STIs is really easy, and there are ways we can have safer sex through different forms of protection and getting tested yearly if you are sexually active. STIs come in 3 different types: bacterial, viral, and parasitic. A bacterial STI is a sexually transmitted infection caused by bacteria. Bacteria are living organisms that can reproduce on their own. Bacterial STIs are treatable, though they can cause more problems if left untreated. For this reason, early diagnosis and treatment are key. Some common bacterial STIs are bacterial vaginosis, or BV for short. Although BV's cause is still unknown, an imbalance of vaginal bacteria is sometimes brought on by douching, not using condoms during sex, or new or multiple sexual partners can increase your chances of getting BV. You can expect BV to cause an off-white vaginal discharge with a fishy smell, or sometimes nothing at all. BV increases your risk of getting some other STIs. Bacterial vaginosis can be treated with an antibiotic. Chlamydia. Chlamydia is one of the most common STIs that affects people under the age of 25. Most penis owners and vulva owners that catch chlamydia have no symptoms, so they don't know when they have it and tend to infect other people quickly. Chlamydia can cause some serious problems such as pelvic inflammation disease, infertility, and tubal pregnancy. People who are sexually active should get tested for it at least once a year. Chlamydia is treatable with antibiotics. Gonorrhea, also known as the clap. Penis owners who have gonorrhea will experience burning when they pee or a yellow discharge from their penis. Vulva owners usually don't know that they have gonorrhea. Much like chlamydia, gonorrhea can cause some serious problems, such as pelvic inflammation disease, tubal pregnancies, and infertility. Once again, people should get tested for it yearly. Gonorrhea is treatable with antibiotics. Syphilis. Syphilis is spread by blood and body fluids of infected individuals and/or through shared drug needles. Syphilis shows up in symptoms in 4 stages. 1, the primary stage, with a single painless sore that lasts 3 to 6 weeks. 2, the secondary stage. Up to 180 days after the first sore, syphilis can cause a skin rash, lesions in the mouth, on the vagina, or on the anus. Stage 3, the hidden stage. This is caused when someone does not seek treatment and shows no additional symptoms. Stage 4, the late stage. This stage is dangerous and can cause damage to internal organs, including the brain. Syphilis is treatable with antibiotics if caught early. A viral STI is a sexually transmitted infection that is caused by a virus. Unlike bacteria, viruses are not living organisms and need a host cell in order to replicate and survive. Some common viral STIs are HIV. HIV is spread through blood or body fluids of an infected individual. This can be through sharing drug needles, sexual intercourse, or from mother to baby during pregnancy, delivery, or breastfeeding. HIV's initial stages can cause severe flu-like symptoms. Treatment is very important. Without treatment, HIV can develop into AIDS. The treatment for HIV would be antiretroviral therapy, also known as ART medication. Human papillomavirus, or HPV. HPV can exist in 40 different strains that affects the anal and genital areas. Some of these strains causing warts and others causing pre-cancer and cancer. There are vaccinations for some strains, and there are medications for removing warts caused by HPV. The treatment is vaccination from some types of HPV strains and medication for the warts. Herpes. Herpes can be spread by touching another person who already has it, even if the person has no symptoms. This is called viral shedding. You can also become infected by touching one of the herpes sores or the body fluids of an infected person. After herpes first infection, it can come back from time to time in forms of small clusters of sores. This infection persists for life, but antiviral medications is available to help decrease transmission to partners and to treat outbreaks. A parasitic STI is a sexually transmitted infection that's caused by a parasite rather than bacteria or a virus. A parasite is an organism that lives on or in a host organism, in this case a human body, and gets its food from or at the experience of the host. Some common parasitic STIs are trichomoniasis, also known as trich. Most penis owners do not know that they are infected with it. But when the symptoms do show up, they often show up in vulva owners and can cause vaginal discharge that may be yellow or greenish in color. Trich is spread by unprotected sex, so the best way to prevent trich is by using condoms during sex. It's also treatable with antibiotics. Pubic lice, also known as crabs, is much like lice that can be caught on the hair of your head, but live in the pubic region. Pubic lice can cause severe itching, and its treatment would be using lice lotion or shampoos. Scabies is much like lice, whereas the parasite lives under the skin. These parasites are spread through skin-to-skin contact. It can cause a severe itching on any part of the body, and its treatment is an antibacterial lotion. Giardia is most commonly spread through anal sex. This can cause a severe stomach ache and needs to be treated with antibiotics.
Now, let's go back to the way we can have safer sex. We have something called a barrier method, which does exactly what it sounds like. It creates a barrier between you and the other person's genitals. The barrier method for a penis is called a condom. A condom can be used for oral sex on a penis, which is when a person gives pleasure to a penis by using their mouth, or when having vaginal to penis sex, which is when a penis is inserted into a vagina. Or it can also be used for anal sex, which is when a penis is inserted into a person's anus. That's the hole we pay from.
Using a latex condom isn't exactly rocket science. I mean, just open the package and put it on, right? Well, sure, but there are actually some things you can do to make condoms more effective at preventing pregnancy and sexually transmitted infections. First of all, condoms can get old and weak after a couple of years, but every condom package has an expiration date. If it's past expiration date, use a newer condom. The package should be sealed so that when you squeeze it, you can feel a little air bubble. If the outside is sticky, damaged, or torn, it could mean that the condom is damaged. That's no good. Open the package gently with your fingers. No scissors or a sharp object that could poke a hole through the latex. Next, you want to pinch the tip of the condom. This gets rid of any air bubble that could cause the condom to break. Before the condom touches the penis, make sure it will roll down correctly. If you put it on the wrong way, it won't roll down easily. Roll down the condom to the base of the penis. Smooth out any air bubbles and add lube. Now you're ready for intercourse. You don't need my help for that. After sex, hold the condom against the base of the penis while pulling out. A lot of guys will lose their erection pretty soon after ejaculating. If you wait too long, the penis will get soft and the condom could roll off or semen could spill out. Holding the condom against the penis while pulling out prevents that from happening. Take the condom off away from your partner. Tie it close and you're done. Congratulations, you just prevented a pregnancy, a sexually transmitted infection, or both. Let's talk lubrication. Some condoms come lubricated, some don't. Some people like extra lubrication. Lubrication is a good thing, but make sure it's the right kind. Oil-based lubricants weaken the latex, making it more likely for the condom to break. So always use a water or silicone-based lube. Not sure if your lube is condom safe? Check out the package or read the ingredient list. Allergic to latex? Use a non-latex condom. So let's review. Expiration date. Check the package. Open gently. Pinch the tip. Roll correctly. Hold the base. Tie it off. No oil-based lube. I know it sounds like a lot, but if you don't have a lot of experience, you can always practice on yourself ahead of time. Don't have a penis? I'm sure you can find something around the house that will work. Condoms are available for free at many Planned Parenthood health centers. To find the one near you, visit PlannedParenthood.org and click on Find a Health Center.
A vulva has two barrier methods. A dental dam, which is pulled over the vulva and used when there's oral sex happening on the vulva. There's also a female condom. This is inserted inside the vulva with one end which sits close to the cervix and the other end sits on the outside of the body.
This is a dental dam demonstration. A dental dam is a piece of material that lowers the risk of STIs during oral sex on a vulva or anus by providing a barrier between one partner's vulva or anus and the other partner's mouth. It can be quick and easy to make a dental dam. You will need one condom and one pair of scissors. If someone is allergic to latex, they can use a latex-free condom. Any condom that says it protects against pregnancy, STIs, and HIV is made out of a material that works. Before using a condom, there are two things to check. The first is the expiry date. Condoms break down over time. Check the expiry date printed on the condom package or on the box. This one has not expired yet, so it would be good to use today. The second thing to check is that the package does not have any holes and that it looks like it's in good condition. To do this, squeeze the package and make sure to feel for a pocket of air, like a bag of chips. That shows there are no holes in the condom package. Now is a good time for a reminder. Condoms need careful storage. They are sensitive to heat, cold, folding, sunlight, and rubbing. I am now ready to open the condom package. To open a condom, push the condom over to one side and then rip down the other side of the package. Be careful. Fingernails and jewelry can damage condoms. Never use teeth or scissors to open a condom package. While the condom is still rolled up, cut the tip of the condom off. Keep the condom rolled up and put the scissors through the middle and cut through one side of the ring. Unroll the condom. You now have a rectangular piece of material to be spread out over a vulva or anus and act as a barrier. Place the dental dam over the vulva or anus. Lubricant can help the dental dam to stick to the skin so it stays in place. You can also hold it in place. It's important each partner only touches their own side of the dental dam. This way, each partner's skin and body fluids do not touch the other person's. After sex, carefully fold the dental dam up, only touching your own side. Throw it in the garbage, not in the toilet, because it can clog your toilet or wreck your septic system. Use dental dams one at a time and use a new dam each time you have sex. If you switch sexual activities, like going from oral sex on an anus to oral sex on a vulva, use a new dam.
It's called a female condom. And while it looks a little strange, it's great because it gives you control of preventing pregnancy and reducing the risk of sexually transmitted infections. The female condom is a plastic pouch with two rings, one at each end. The inner ring is squeezed and inserted into the vagina before sex. The outer ring stays outside the vagina and covers part of the vulva. After sex, just remove it and throw it away. The female condom works by collecting semen when a man ejaculates, comes. This keeps sperm from entering the vagina. No sperm, no pregnancy. In fact, less than 5 out of 100 women will get pregnant each year if they use a female condom correctly every time they have sex. That goes up to about 20 out of 100 women if they don't always use it the right way. It can be used for vaginal sex or inserted into the anus to reduce the risk of STDs during anal sex. There are no side effects, no prescriptions, no trips to the doctor. Except for the latex condom, it can also be used with almost any other method of birth control. If you'd like to learn more about female condoms, you should check out PlannedParenthood.org.
Taking School of Sexuality's classes could have some side effects. Side effects may include, but are not limited to, new ideas, confusion, happiness, communication skills, urges to be yourself, self-love, better friendships, new values, excitement, confidence, compassion, discernment, sympathy, tolerance, thoughtfulness, respect, and big questions. For any questions you may have, contact us immediately.